What is a water birth? A water birth is when a pregnant person decides they wish to experience labor and delivery in a pool or tub of warm water. During a water birth, a birthing person who is in labor will get into the pool or tub of warm water at a certain stage of labor and can choose to stay in the water during the pushing stage. They also have the choice to get out if that is what feels best for them or requested by the medical professional. If one chooses to stay in the pool or tub of warm water during the pushing stage, the baby will be born under the water and then brought to the surface. Once the baby has been born, the birth of the placenta can also take place in the pool or tub. When having a water birth, you may also hear the term used hydrotherapy. Where can a water birth take place? Only a few hospitals have the accessibility to water birth. Therefore, there are a couple of other options. You may wish to have your water birth in the comfort of your own home or at a birthing center. The difference between the hospital, birth center, or your home would be birth center. A water birth center is usually equipped with the tools that may be needed during labor and delivery, such as IVs, oxygen, medication, and resuscitation equipment. Hospital. Having your water birth at the hospital allows for more quick and accessible access to medical care in the case of an emergency. At home, having your birth at home can provide a more relaxed and comfortable environment for labor and delivery. You will have your midwife available to provide medical assistance, and you may also choose to have other support people there, such as a doula, to assist with the process. Benefits of a water birth. There are many different pros and cons to having a water birth, and one must choose what best suits them for the labor and delivery. There are mixed reviews on water births. However, in 2017, a study was concluded that reviewed 7 randomized trials of 2,615 participants. This study found that laboring in water poses no extra risks to the birthing person or the baby. With the studies that have been done, here are some of the benefits that have been identified with water births. Shorter labors. In 2015, a randomized trial was done on 160 first time mothers. This research showed that the total length of labor was shorter for the people giving birth in water by an average of 50 minutes. Higher rate of vaginal birth. Individuals who have water births are less likely to have a birthing experience using pain medication and medical procedures. Lower rate of severe tears. Giving birth in water may cause the birthing person to be more likely to have a small tear. However, birthing in water can also cause the birthing person to be less likely to have a severe tear or an episiotomy. Lower rate of postpartum hemorrhage. A study in 2014 found that when birthing in water, individuals are less likely to experience a total or equal blood loss to those who give birth on land. Protective against episiotomies. An episiotomy is when the medical professional has to make a surgical cut in the perineum during birth, in which research has shown that episiotomy can be more harmful to those giving birth than a natural tear. Upright birthing position. Research has shown that individuals birthing in water are more likely to have an upright birthing position, as well as a hands off birth, in which the care provider does not routinely touch the baby's head or the birthing person. Maternal transfers to the hospital. The MANA Stats study found that people who had births in their homes and in birth centers were less likely to be transferred to the hospital after giving birth and fewer hospitalizations in the first 6 weeks of postpartum compared to those who gave birth on land out of a hospital. Maternal infection. Studies have shown that water births do not increase the risk for maternal infection when compared to those who gave birth on land. Less pain. With that being said, labor and delivery will have the potential to be a very painful experience. However, being in an environment that encourages the feeling of safety and relaxation can promote a less painful experience. Less medication used during a water birth. Again, pain can and will still occur, but in a more comfortable, relaxed environment, which can promote a less painful experience, can also support a labor and delivery process with less medication. Higher satisfaction with the birth experience. A 2014 review found that 72.3% of people giving birth in water would choose this method again. Less use of artificial oxytocin. Feeling more relaxed and comfortable will allow the body to produce the natural oxytocin needed for having a birthing experience that may be more enjoyable. Benefits for the newborn. Newborn death. Studies have shown there is no difference between water births and land births when it comes to newborn death. Apgar scores. An Apgar score is a way to check the health of the newborn. Scores can range from 0 to 10. Apgar scores of 7 are considered normal. Studies have shown that there is no difference in Apgar scores when one has had a water birth or a land birth. Breathing difficulties. Studies showed that the odds of breathing difficulties were lower for babies born underwater. Newborn transfers to the hospital and hospitalizations. Odds for NICU hospitalizations and transfers to the hospital were lower after a water birth and are less likely to have to go to a hospital in the first 6 weeks of life. Umbilical cord pH. A high pH level means the newborn is healthy. Studies have found that there is no difference between land and water births. Shoulder dystocia. This occurs when the baby's head passes through the birth canal, but the shoulder gets stuck. Studies have found there is no difference between water and land births. Newborn hypothermia. Studies have shown when birthing in water, the chances of hypothermia are lower. What are the risks? More research needs to be done so it can make water births a difficult choice for some to make. There is a chance of mild tears. Umbilical cord snap is rare, but is possible. The chance of infection after water birth is possible. However, more research is needed, and risks of infection can be lowered by ensuring the water is clean, filling the tubs closer to the time of birth, and regularly testing the water. Here are some cases in which one may be advised to avoid having a water birth. You have a high-risk pregnancy. You have high blood pressure. You go into labor earlier than expected, so under 37 weeks gestation. Your baby is breech. You are older than 35 years old. You are having more than one baby. Excessive vaginal bleeding. Maternal fever greater than 100.4 or suspected maternal infection. Any condition that requires continuous fetal heart rate monitoring. Untreated blood or skin infection, sedation or epidural, or a fearful attendant. How to plan for a water birth. First, you will want to plan out who is your birth attendant. Second, you will want to make sure you have all the water birth supplies, such as a birth pool if your midwife doesn't have one, drinking water hose, a water filter, soft towels and washcloths, a bowl for cold water or a fan to cool mom, 1 to 2 large stock pots for boiling water if needed, and checks pads in case you want to deliver on land. The third step is to know when to fill the tub. For first-time moms, begin filling the pool when contractions are 3 to 4 minutes apart for an hour. Some midwives won't want you to get into the tub until transition because sometimes water can stall contractions. For experienced moms, you can fill the tub when contractions are about 5 minutes apart. When you need to start focusing during contractions and can't talk through them, begin filling the tub. The fourth step, you will want to know what the temperature should be. The temperature of the water should be as close to body temperature as possible, but not over 100 degrees. You can get a bath thermometer to monitor the temperature. And the fifth step to planning out your water birth is to know when to get into the tub. Midwives often caution moms not to get into the tub until they are 5 to 6 centimeters dilated. One reason for this is that water may slow or stop the labor process. Here are some questions you may be wondering. Can a baby drown during a water birth? No. There are 4 main reasons that babies don't aspirate water during a water birth. Keep in mind that you will never keep a baby submerged and should bring their head to the surface immediately. Prostaglandin E2, the hormone that starts labor, restricts the baby's ability to breathe directly after birth. Babies are born with mild hypoxia, so a lack of oxygen, which suspends the breathing. Fetal lungs are already filled with amniotic fluid, which protects the lungs, similarly to the way meconium protects the colon. It's highly unlikely that fluid from the birth tub could displace the thick fluid in the lungs. And the dive reflex protects babies from drowning. Infants up to 6 months old automatically hold their breath when submerged in water. Is water birth sanitary? Some physicians are concerned about potential infection due to water birth. However, the research shows that there is not an increased risk for infection for mom or baby during a water birth, as long as precautions are taken, such as properly cleaning the tub with non-toxic cleaners, using clean water, preferably filtered, especially if you have chlorinated water, changing the water if it's contaminated with excessive feces, being careful to leave the vernix intact after baby is born, and blood often drops to the bottom of the tub and congeals, and feces can be scooped out. So there really isn't as much mess as you might think. Here are just a few links you may wish to check out where you can find more information on water births. Have a look and see what you can find. If you are curious about what a water birth may look like, here are 10 water birth videos which you can watch on Mama Natural's website. Have a look and see if a water birth is right for you. As a full spectrum holistic reproductive practitioner, I am a doula that can be there to support your water birth. Here is a photo of the birthing pool I have that you can use for your water birth. I have also taken training for reflexology and Reiki for fertility and am capable of offering different forms of support for your labor and delivery. If you would like more information, book a free consultation with me today. Just scan the QR code and it will take you right to my website where you can learn more information and book your consultation.